We'll begin with our story about peripheral arterial disease. You may not have heard of PAD, but a surprising number of Americans have it, and if it proceeds unchecked, it can be fatal. Fortunately, you can do something about it. Let's watch.
I found about PAD quite by accident. I had a heart attack that resulted in a quadruple bypass, and in recovery they recommended that I do some exercise to basically regain my strength.
10 to 12 million Americans have peripheral arterial disease, or PAD. Most, like Andrew Johnson, are unaware that they have it.
How you doing today?
We're going to measure your ankle brachial index or your ABI and see how your circulation is to your feet. Peripheral arterial disease is blockage of the arteries of the abdomen and legs. It's caused by the same buildup of plaque that causes heart attacks and strokes.
I started out very slowly, but worked up to trying to walk about a mile a day. It was uncomfortable to do my daily walk, and I just didn't think that that was right.
Many people with PAD are asymptomatic. However, as the blockages become more severe, you may develop difficulty when you walk, consisting of pain or fatigue in the legs, or even ulcers, gangrene, or pain at rest.
I went back to my primary care doctor primarily to see if I could get relief from my pain in my legs. As a result of that request, he referred me to a vascular surgeon.
Early diagnosis of PAD is very important. Patients with PAD, even if they don't have symptoms, are up to 6 times more likely to have a heart attack, stroke, or vascular death than patients without PAD. This is a silent killer that must be stopped.
To diagnose his condition, Andrew's doctor performed a test called the Ankle Brachial Index, or ABI. It's simple and painless, taking about 10 minutes.
How have you been getting along with your walking?
African Americans are twice as likely to have PAD as non-African Americans. Unfortunately, they are less likely to get prompt and effective treatment than other groups, and much more likely to receive an amputation as their first form of treatment.
After that examination, I had a minor operation where they inserted a stent in my groin area to help with the flow of blood to my legs. I was not completely cured, but I enjoy dancing.
Your primary care physician can screen you for PAD, and during September, Vascular Disease Awareness Month, the Society of International Radiology offers free PAD screenings through a program that it calls Legs for Life.
Legs for Life is a program begun by the Society of Interventional Radiology 8 years ago. It's a screening and educational program that allows physicians to help establish the diagnosis in patients and to provide education and risk awareness.
Whether or not you've had a PAD screening, you can take some simple steps that doctors believe will minimize your chances of developing PAD.
PAD is a preventable disease. It also can be controlled. The best way, if you are a smoker, is to stop smoking immediately. Aside from that, maintaining a normal blood pressure, normal cholesterol levels, and exercising regularly are very important.
Those same steps are often recommended by doctors to maintain your overall health. In other words, taking care of the arteries in your abdomen and legs is another way of taking good care of yourself.
We're grateful to have in the studio today Harvey Weiner, who is a doctor of osteopathy and an interventional radiologist with Arizona Medical Imaging. Dr. Weiner is also the chairman of the Society of Interventional Radiology's Legs for Life program. Welcome to the program.
Thanks for having me.
Tell me a little bit about Legs for Life. What is it?
Legs for Life is a screening program that began approximately 8 or 9 years ago, sponsored by the Society of Interventional Radiology, to look at people who have peripheral arterial disease, trouble walking. Typically the patients we try to screen are those that are greater than 60 years old, who maybe when they go out to their mailboxes or go out to walk their dogs find that they have cramps in their calves or their thighs. By having a screening program and by screening these people, we're able to tell them early on that they have poor circulation and try to get help for them before it's either too late or irreparable.
Does PAD actually affect older adults more than it does younger people?
Typically, yes, Ashley. What happens is the PAD is most common in those people over the age of 60, but also the commonality can go back to 50 years of age. Also those people who smoke, those people who have sedentary lifestyles, those people who are diabetic, hypertension, high blood pressure, increased cholesterol, if you have these problems that are untreated, plus a poor genetic history, and over the age of 60, you're at risk for PAD.
Now, is PAD what was formerly known as hardening of the arteries? Or?
PAD equals hardening of the arteries equals PVD, or peripheral vascular disease. That was the prior acronym that we used.
Why is it then that we focus more on the legs and the abdomen with PAD than we did, for instance, with hardening of the arteries?
Well, the legs and the abdomen are very easy to check whether or not you have arterial insufficiency. By then doing that, you can then screen the patient further on for heart or carotid disease, in other words, for heart attack or stroke. You may know through people that you've worked with over the years that a stroke comes on suddenly, a heart attack comes on suddenly. Occasionally you might have some dizziness or some chest pain that would be a harbinger of this bad event. Peripheral arterial disease has intermittent claudication, a lameness, a trouble walking. By having a difficulty in walking, you screen the patient.
Claudication is when you have a blood clot that occurs in a part of your body, or is that something different?
No, a blood clot is a thrombosis.
Okay.
Claudication is a Latin derived word meaning lameness, trouble walking.
Oh, okay. So your gait is off a little bit and you can't walk as well.
You have cramps.
Okay.
And they're very reproducible. You get up, and as I said earlier, you go out and walk your dog. One of my favorite patients in my career was a gentleman that was on the senior softball league, and he came to see me because he couldn't run to first base as well as he wanted to, because he had cramps.
Now, most of our viewers are mature adults. Why is it important for them to make sure they go and get screened for this kind of problem?
There are a number of reasons, Ashley. One reason is that as Americans become older, they still want to maintain active lifestyles. By getting screened for these issues, these vascular issues, you can uncover peripheral arterial disease, in other words, trouble walking. You can uncover abdominal aortic aneurysms, which is a bubble in the main blood vessel in the abdomen, in the belly. You can potentially then go on to screen for silent heart disease and silent carotid disease. So in essence, what you're doing is you're trying to help the older Americans not suffer debilitating stroke, not suffer debilitating heart attack, not die from an aneurysm, and maintain their active lifestyles.
Wow, that's a phenomenal test.
It is.
In the package, they talked a little bit about the fact that African Americans were at higher risk. Why is that?
There are a number of theories, everything from access to health care to genetic predisposition to hypertension that is not well controlled, and diabetes and kidney disease that is not well controlled.
So let's say you go to your interventional radiologist and you're diagnosed and you have PAD. What are next steps?
If you do have a demonstrable abnormality from an ankle brachial index, then an arteriogram, either done using the newer generation of CAT scans or conventionally with a catheter being a little skinny plastic tube about as wide as a piece of spaghetti that is advanced into the artery from a puncture in the groin or the arm. And then both examinations require the injection of X-ray dye, which is a clear liquid that is iodine-based and that comes up white or black on X-rays.
You talked about a brachial index. What is that?
The ankle brachial index is a ratio. It's a blood pressure test, completely non-invasive. It takes 5 minutes to do, as we saw in the package, where you measure the blood pressure in the arm, and you measure the blood pressure in the ankle. You then take the peak blood pressure of the ankle and you divide that by the peak blood pressure of the arm, and you get a ratio. 0.9 to 1.1, 1.2 is normal. below 0.9 is abnormal.
Before we close, what are some of the treatments that would be helpful for someone that has PAD?
The treatments that would be most efficacious at this point would be angioplasty and stenting.
Okay.
And after angioplasty and stenting, one can then potentially undergo surgery. Surgery can also be lessened, or the extent of surgery can be lessened.
Well, listen, Dr. Weiner, thank you so much for your help. This has been incredible information for us. We appreciate it.
It's my pleasure. Thank you.